Hi friends, in this video I will tell you a very simple trick with the help of which you can easily remember the dermatomes of the lower limb. So this is our spinal cord and these are the spinal nerves from the L2 to S2 segments, because these are the main nerves which supplies the skin of the lower limb. And these are the parts of the lower limb, and it includes the thigh, the knee, the leg, the ankle and the foot. This one is the anterior side of the lower limb and this one is the posterior side of the lower limb. And this one is the medial side of the thigh and knee. This one is the lateral side of the thigh and knee. This one is the anterior side of the thigh and knee. This one is the posterior side of the thigh and knee. This one is the medial half of the leg. This one is the lateral half of the leg. This one is the posterior side of the leg. Here is our ankle and there are no such anterior, posterior, medial, lateral in the ankle, okay. This one is the medial half of the foot in the anterior aspect and this one is the medial half of the foot in the posterior aspect. This one is the lateral half of the foot anteriorly and this one is the lateral half of the foot posteriorly or within the dorsum of the foot. So these are the main regions of the lower limb which are very important with respect to the dermatomes of the lower limb. Now these L2 and L3 are related to thigh and knee. L4 and L5 are related to leg. This S1 is related to what? Ankle. And L5 and S1 are related to what? Related to foot. And this S2 is related to posterior side of the thigh, knee and the leg. Now this one is the upper 2/3 of the thigh and this one is the lower 1/3 of the thigh. So this L2 nerve supplies the upper 2/3 of the thigh, anterior, lateral and medial all, okay. And this L3 is related to lower 1/3 of the thigh. And L3 is also related to this knee. L4 is related to medial side of the leg. L5 is related to lateral side of the leg. S1 is related to ankle, as the pronunciation of ankle is very similar to akela. Akela means ankle is innervated by only one spinal nerve, and that one is the one means one spinal nerve means this one is the S1. So whole of the ankle is supplied innervated by the S1 root value. S1 complete anterior, posterior, medial, lateral, all things. So ankle is supplied by innervated by which root value? It is by the S1. Now in the foot, from this F it is related to 5 and this T is related to number 1. It means the medial side of the foot is supplied by innervated by the L5 and the lateral half of the foot is innervated by the S1. Medial, anterior as well as posterior is supplied by innervated by which? L5, and the lateral side is innervated by the S1. Because from the foot you can easily derive number 5 and from T you can easily derive number 1, because on the top only single person is there. So from T it is related to top and on the top there is only single person, and that single person is what? That is the S1. So foot is innervated by the L5, medial side, medial half of the foot is innervated by the L5 and the lateral side is innervated by the S1. It means the first interphalangeal part is innervated by which root value? It is by the L5. And this was the MCQ which was asked in previous PG entrance exam. And this first interphalangeal space is called what? It is called first wave space. and this first wave space is present on the medial side, and the medial half is innervated by the L5. So first wave space is innervated by which root value? It is by the L5, and the whole of the posterior aspect of the thigh, knee and the leg is innervated by the S2 root value. Okay. So my dear friends, in this way you can remember the dermatomes of the lower limb. I hope you have understood very well these dermatomes of the lower limb. And if you really like this video, then please share this video as much as possible to your needy friends. And in the last but not the least, thanks for watching this video, and I wish you all the best for your bright future.